Hello and welcome to your ASMR dental examination today. I have you booked in for a consultation for some cosmetic work as well. Is that what you were looking for? Of course, we can discuss that. That's absolutely fine. But what I need to do first is just to check the overall health of your mouth, because it's important that we address any underlying dental health issues before we go ahead and begin cosmetic work. You want a beautiful smile that's also a healthy smile. Good. There's nothing to be nervous about. I'll be gentle and delicate with you at all times. If you need a rest at any point, you can just raise your hand and let me know, okay? Lovely. I'm going to begin then just by examining your face. Just going to feel around your jaw and your neck, okay? Place my hands either side of your jaw. If you could just open your mouth wide for me, please. That's it. And close your mouth. And open your mouth again. Lovely. And close again. Do you ever get any clicking in your jaw when you open and close it? Okay. If you could close your mouth tightly for me a moment, just bite your teeth together. Onto your neck. Wonderful job, okay. You feeling alright there? Are you happy for me to have a look inside your mouth now? Good. Okay. I would like you to start by giving me a nice, big, wide smile. That's lovely, okay. Right, and just bite your teeth together for me. Okay, very good. Just going to use this mirror to have a little look around in there. So if you could open nice and wide for me. brushing your teeth. They look lovely and clean, not too much build up in there at all, so that's really good news. I'm just going to use a couple of tools now to check the teeth themselves and also your gums, okay? So just inside the mouth there again, I'm going to start up on this back right side. Let's begin by counting them. So we have 8, 7, 6, 5, 4, 3, 2, and 1. And on the upper left side we have 1, 2, 3, 4, 5, 6, 7, and 8 there, which is just partially erupted. Do you get any pain at all around your wisdom tooth on the back left side as it's been coming through? No, that's very lucky. A lot of people have trouble with those. Okay, let's have a look at the bottom as well. So we have 7, 6, 5, 4, 3, 2, 1, 2, C, 4, 5, 6, 7, and 8. So we don't have the wisdom tooth left yet on your lower left side. Do you mind if I feel the gum there? Okay. I imagine that one's going to come through fairly soon from how that's feeling. It feels as though it's just beneath the surface there. Interestingly, we also have one of your front teeth here that's a baby tooth. So it seems as though the adult tooth has never come through. Were you aware of that? So you can see that it is a little bit smaller than on the left side, the equivalent tooth. I'm just going to feel it to see how solidly it is in there, okay? It's a little wobble. Okay, good, so that one's not moving around at all. Baby teeth can stay. It could certainly stay for the duration of your life. It's been known to happen. It may well come out on its own at some point. It's something to think about. We would probably need to do an X-ray to see where that adult tooth is, whether it's somewhere down there buried in the lower gum and just hasn't erupted for whatever reason, or if it's perhaps not there at all. Something to consider perhaps in the future as to whether you feel you want to have that baby one taken out and perhaps replaced with an implant or a bridge or something like that. No, it looks very, very healthy, so you don't need to do anything with it right now, unless of course you wanted to, but we will come on to that, okay? Good. So I'm just going to feel around the teeth themselves and the gums for a moment or two, alright? Again, nothing too uncomfortable, but if you do need me to stop raise your hands and let me know, okay? Here we go then, starting on this left side again. And the lower teeth as well. You okay so far? Good. Excellent, okay. I'm just also going to press into the gum. Just very Okay. So overall, your gums are in very, very good shape. There are just a couple of areas towards the back molars, the large teeth at the back, and on the back of the top teeth and the bottom teeth at the front, where the gums look a tiny bit inflamed, and there's a little bit of blood there just when I'm pressing. So it's nothing that I think can't be sorted with a little bit of extra flossing. Do you floss every day at the moment? Okay, and how often are you brushing your teeth? Twice a day? Okay. Do you ever use interdental brushes? Okay. So I might give you some interdental brushes to try just in those back teeth. It might feel a little sore at first, but we'll just have to remove the build-up of bacteria that's between the teeth there that normal toothbrushing doesn't get to, and that will really help to improve the gum there so that it's not looking as inflamed. I can also give you some special mouthwash that will really, really help to clear it all up. It's absolutely fine to see it all the time. There are certain places in the mouth that are very hard to reach. Are you using a manual toothbrush or an electric toothbrush? You can get excellent results with both. I do personally prefer an electric toothbrush, but it's entirely up to you. If you prefer a manual, they can certainly do a great job. Okay. Lovely. Alright then. Let's talk about the cosmetic work that you'd like doing then. So tell me a little bit about what it is about your smile that you're not happy with or that you'd like to change. Okay. I see. And this is something you're conscious of when you're in photos and things. I understand. Okay, let me just have another quick look then. So if you could do a nice big smile for me. Let's see. Okay. So I can see what you're saying, that the centre line of your top teeth and your bottom teeth don't quite line up. It's possible that the centre line of your top teeth is off slightly, but the thing about faces is that they are not entirely symmetrical. So if you were to find the centre point between your eyes, the centre of your nose and the centre of your chin, for example, and draw a line down, you'd find that it wasn't a straight line anyway. So it can be quite deceiving when we look at these things in relation to one another. And in terms of the colour, that's easily something that we could rectify with some whitening. Do you drink a lot of coffee? Have you ever smoked, or are you a smoker? So these are things, red wine as well, things like that can stain the teeth over time. What sort of level of whiteness were you thinking? Did you want it really white, something slightly more natural. Okay. So you were talking just now about the symmetry of your smile, and that your eyes are drawn to the smaller teeth either side of your two front teeth, one of which is slightly rotated, and the canine there which protrudes slightly more. And you mentioned that they are different sizes, which I can see here. I think it's quite subtle. I don't think it's something that would take too much work to address. In terms of the centre line and the tooth that comes out slightly further, if you could just bite for me again, bite your teeth together. Okay, so we could potentially consider some orthodontic work for you, some braces. There are some very good options for near invisible braces actually on the market today. They can either be fixed over your teeth and look very, very subtle, or even on the back of your teeth to move your teeth around, and it wouldn't take too long to work. So I can just see on this left side here, the canine there. You're lucky that your teeth aren't too overcrowded. You do have a little bit of space in there to play with, so a good orthodontist I think would be able to address that for you if you wanted to go down the orthodontic route first. The other option is we could look at perhaps some composites for you, or some veneers. Composites would be a very subtle way of changing what's already here, just to address the size discrepancy for you and the unevenness that you're seeing. It wouldn't really address that the tooth is slightly twisted. You would need orthodontics for that. But I think we could do something to lessen the appearance of it, to draw your attention away from it. I personally think you have an absolutely beautiful smile. People often come in and ask for neat, symmetrical little teeth, but I think actually a little bit of asymmetry is what makes us beautiful and makes it look all the more natural. If you look at kind of traditional false teeth, they can be very, very straight, very neat, very white, but it does give that kind of false look. So it's up to you really. If you like that look, that's absolutely fine if that's what you want to go for. What about the bottom row? Are you happy with these? So you do have a slight underbite on one of the back teeth compared to the top, but it's so subtle and it's not really something visible. And if this is about how things look for you, it's up to you as to whether you would want to have that addressed with orthodontics, but visually I really don't think it would cause you a problem. The baby tooth there, which I mentioned, that's slightly smaller. If you could just smile for me one more time. Good. So your smile, when you smile, those bottom teeth are all covered. You can't see them, you can only see the top teeth. So that's very much hidden at the moment. You do have the option of having that one removed, as I said earlier. We could look at the possibility of putting an implant in there for a full-sized adult tooth, or even crowns on the teeth either side and then a bridge, so we fill the gap in with a tooth that is connected to the teeth either side. That could also be an option for you. But overall, I think it's healthy. It's not visible when you smile, and with a little bit of whitening down there as well to match the top row, I it would look lovely. What do you think? Not so bothered about that. Okay. What I could do for you today to give you an idea of the results is I can take a scan of your mouth so that we have a 3D visual scan, and we can apply some digital imaging to it so that you can kind of see what the outcome would be. But I can also actually apply a little bit of composite for you right now, that you can go away for the day, wear it, come back a bit later on and I can remove it for you, just so you can see roughly what the results might be. We call it a trial smile. What do you think of that? Of course I can. Lovely. Okay, so if you don't mind, I'm going to begin then by scanning your teeth. Thank you. Okay, I'll just get this one set up and connected to my computer over here. There we go. Okay, so it's just got a little camera in the end of it there. It's going to run over your teeth and your gums and create a 3D visual of your mouth. Alright? Wonderful, here we go then. If you could just smile for me for the moment with your teeth together. That's it, and here we go. And relax your mouth now so you're not smiling but your teeth are still together and your mouth is open. That's it, well done. I'm just going to come around here and open. Pull your cheek open slightly so I can get this one in. Great job. Thank you. Coming underneath those top ones now. So this is just capturing the bite as it stands. So just try to keep those nice and together for me. Lovely. Well done. Okay, have a little rest for a moment. Good. And now if you could open your mouth nice and wide for me, I'm just going to capture the inside. So here we go again. I'll start on this right side this time. There we go. And over to this. Doing a lovely job on the computer there. Now let's just do the lower. Okay, we've got everywhere we need. We do. Perfect, well done. That wasn't too uncomfortable for you. No, good. So before we begin applying your composites today, I'm just going to give your mouth a really good rinse out. Is that alright? Thank you. So I just have the little suction device here and a little brush head, and I'm just going to work these around inside your mouth. just feel a little jet of water, but nothing too strong or painful. Here we go, it won't be uncomfortable, I promise. Done with that, okay. So what I'm going to do now is apply that temporary composite to your teeth, and you'll have to make sure that you don't eat anything too hard while you have it on, so no nuts or anything like that, because it will just chip off quite easily. But it should stay on nicely for a few hours, just so you can really get a feel for the kind of result that we could achieve without any orthodontics or without anything else, just a kind of composite or a veneer instead. Okay, right, here we go. So I'm going to that, they have these little foam roller type things, and what I'm going to do is I'm going to pop them into your mouth, just underneath your lip there, against your gum. Just going to hold your mouth open for me, okay? So firstly on this left side. Does that feel okay there? It's just holding your lip up out of the way, that's all. Okay, same on the right side. Let's have a look there. Perfect. I have my composite here. about that too, so that's slightly twisted just to reduce that appearance there. Bite together for me a moment, just gently. That's it, perfect. Okay, have a look at that quickly for the back. Beautiful. Okay, and now what I'm going to do is just cure it a moment so that it stays on for you. So you might want to just close your eyes for this, a little light, okay? Here we go. It's just going to set that composite on each of those teeth so that it stays on there for a few hours, but it will be very, very easy and very painless to remove when you come back in a few hours, alright? Excellent, you're doing a great job. Just waiting for those teeth to set. A few more moments here. It's quite a bright light, so try not to look at it if you can help it. Okay, I'll just check them a moment. Almost there, just a couple more passes. Left to right, to right, to left. Wonderful. Let's check that there. Feels nice and firm, so it's not going to go anywhere for the moment. As I say, it's only if you were to really bite on something quite hard or eat something quite crunchy that they would start to kind of come apart in your mouth. So do try to avoid that for the next few hours if you can, okay? I'm just going to remove those little bits from your gum line there, these little foam rollers. Okay, and on your right side. Let me just clean up the corners of your mouth for you. Good. And if you could just close your mouth together for me and do a big smile again. Wonderful, I think that's looking beautiful. I'm going to give you some rinse now. So just swirl that one around your mouth and then you can spit out the residue in the sink beside you, but don't swallow any. Okay, here you go. Good. Now, how is that feeling in your mouth? Do they feel bigger or bulkier to you at all? The smallest differences can make quite a change to how things feel inside our mouth, so it will take a little bit of getting used to. It's important that you understand that that doesn't mean that they look necessarily big, it might just be how they feel. Okay, so go ahead, enjoy the rest of your day with your new teeth, have a good look at them, take some photos with them, see how you think they feel. If you're happy with the results of those, in a few hours we can discuss going ahead just with that treatment on a more permanent basis. But if you feel that you'd prefer to have the orthodontics to adjust to the positioning of your teeth in relation to one another, then we can certainly refer you to a specialist orthodontist for that. Okay? Wonderful. It's been a pleasure having you in for your consultation today, and I will look forward to seeing you again very shortly. Bye for now.